Think about the last time you went to a doctor with yourself or a loved one, and you were given a diagnosis that you're not particularly happy with. You were left in a daze, the doctor didn't have a lot of time, and they didn't give you a lot of good information. You immediately ran to Dr. Google, hoping to find something better. But instead, you were overwhelmed with repetitive, irrelevant, outdated, unreliable, unsafe, incomprehensible, inconsistent health information. You simply didn't know what applies to you or what you can trust. Now you're hoping your doctor knows better, but how can they? 20,000 research papers were published just last year just on breast cancer. And there are 1,688 open interventional recruiting clinical trials for breast cancer today. So how could they know all that? And they're pulling their hair out with all the crap that patients bring in to talk to them. So even if they had the time, means, and motivation, they couldn't actually get this done. And biopharma spend billions, take decades to get their new therapies to market, and then struggle to find the patients for their recruiting clinical trials, or to seed their adoption in the market. So this whole thing is actually quite broken. So there's no place people could actually go and get the latest trusted medical information for them. Think about that. So together with my partners, I'm a software developer growing up. I've led innovation in large and small corporations after the acquisitions. My partner, Olin, he's a serial entrepreneur, started 10 other health tech companies. And Professor Steve Kaplan, a world-famous urologist, an accomplished researcher, and an entrepreneur who started Medivizor Solutions. Together we set out to solve this, and Medivizor is an AI-powered GPS to navigate chronic illness. It looks like this. People can sign up to Medivizor today. They go online, they put in information about themselves, their medical situation, the diagnosis, treatment history, and so on. And then we create for them a personalized report, just what matters to them, latest science. And we follow that up with all the clinical trials, research papers, treatment options, guidelines, and more. We deliver each person what matters to them. And we explain it to them in lay language summaries that interpret the science. And if there's a clinical trial, we allow them to apply to that trial directly on the platform. And doctors have a dashboard of all their patients with all the clinical references for those patients. So this is collaboration. We use AI and machine learning technology to comb through enormous amount of new information, medical human experts to train these algorithms and vet their outcome and the wisdom of the crowds to create a laser-focused beam of health information. From the patient perspective, this looks like this. You enter information about yourself, we scan the world of information and deliver the latest that matters to you. We already appear as #1 search result in over 100 terms. We already have over 100,000 fans and followers on Facebook and Twitter, and we're the #1 disease influencer in the conditions that we cover. We're already being distributed and trusted by healthcare providers and by nonprofits, Leukemia and Lymphoma Society, Mount Sinai, and others. We have over 100,000 subscribers around the world, 94% of which recommend the service, and 37% are active after more than 14 months. Now, if you think about health information as a crowded field, you're right. Okay? But we focus squarely on post-diagnosis, serious and chronic, which happens to be 85% of healthcare costs and the prime target for biopharma. From a patient perspective, there really is no place they could actually go. There are many online patient communities with anecdotal information. There are generic and prescriptive health information or patient education. There are clinical trial recruitment sites, but none of them actually deliver what we're talking about. We give this free resource to patients and monetize it by tapping into that clinical trial recruitment path, by tapping into direct-to-consumer marketing in the US. And we've already proven this. In the last 6 months alone, we've crossed 100,000 subscribers. We've secured 6-figure deals with all of those key players that I just mentioned up here. We graduated IBM Alpha Zone Accelerator, sponsored by Beck & Dickinson, and are on track for more than 400% year-over-year growth. It's a large unmet need, scalable, it's automated. We're now raising a Series A to cross 1 million subscribers and 10 million ARR within the next 18 months. Right. Next time when you go to your doctor, they'll give you Medivizor. So you don't need to just search for Dr. Google. Thank you.
How do you manage patient expectations and neutrality when you have on the outside as clients, pharma or marketing companies?
Right, so pharma can't suppress information that's received by patients. Whatever is actually sponsored is marked as promoted, so the patient actually knows that it's sponsored. And for them, it's amazing. This is actually, they less unsubscribe from sponsored content than actual content that is completely unbiased. Okay, and we tell them right now, this is sponsored by Biopharma. You're getting this because we have a relationship with them. So they know it, it's transparent, and it doesn't suppress any piece of information they would otherwise get.
Thanks for your presentation. On knowing that you're using different forms of going out and capturing the data that's out there, and the question would be, what do you think, how much of it are you capturing and what's left uncaptured?
So we scan all PubMed, all clinicaltrials.gov. Okay, 96.5% of literature is published on one of those sources. Okay, we scan that and we decide whether it gets included in our repository. We don't track anecdotal information. We track latest scientific matter.
Can you tell me a little bit about the clinical trial recruitment engine and what level of specificity the patients are receiving with regard to inclusion and exclusion criteria?
So they go through 4 steps of filtering, pre-screening, before they actually are introduced to a trial site. Because first, they don't get any clinical trial that isn't relevant to them. We know about their genomics, their comorbidities, their treatments, everything they put in when they sign up, and they update it frequently. So we actually capture that, and we don't tell them about clinical trials that they're ineligible for. Then they reconfirm with their doctor that they're eligible. They want to apply. They actually take the initiative. So there's a win-win-win situation. The patient is really eager to know about it. This biopharma obviously wants to know about it. The sites want to know about these patients. It's basically a win for all, and it's very, very specific. I can go into more details later.
But specifically, what's the algorithm that matches the patient?
Right. Full semantic inclusion-exclusion criteria. So we read in the whole inclusion-exclusion criteria, and the patient confirms that before we introduce them to the site, but we don't even tell them about the trials that they're ineligible based on our algorithms.
I guess the key in your company would be not only scanning medical literature, but providing meaningful information you provide. That, I think, we all agree. And I'm a little bit skeptical regarding the vastness of all the information that comes around. I mean, I would love to ask you, what do physicians think of your reports?
Sure.
And not only that, but if you could clarify a little more, how do you, I mean, is there any some sort of artificial intelligence doing that, or do you provide a little more insight on that?
Yes, there's AI, and there's also curation by experts. Okay, so it's a combination of the two. I didn't have time to go into a lot of detail on that. And it's 300-word lay language summaries that are an interpretation of the research in contrast to all the other medical literature. So it's actually very contextualized, better than practically anything to interpret latest science for individuals. Doctors, actually, the first reaction is, no, not more information to my patients. 5 minutes later, they want to give it to all their patients. Okay, because they understand, A, what it does to the patient. It focuses them, it gives them only reliable information, and they get a heads up of what the patients are going to receive.
But do they think your reports are reliable? I mean, have you conducted any tests among them, saying from 1 to 10, what do you think about the reports? What would be their answer?
We haven't. It's a great question. We need to ask doctors that. Great question. So far, they, very quickly, they decide to prescribe Medivizor to all their patients. And we have a method to onboard clinics in 20 minutes. Where they actually, and by the way, Medivizor is given to in clinics by hundreds of patients at over 50 locations in the U.S. every day right now. Okay, I forgot kind of to mention that. So it's being given by the doctors to the patients. That's where it's being distributed. It's on main websites. It's on the Leukemia Lymphoma Society website, and more and more. So.
All right, one last question, please.
How would you compare Medivizor to something like WebMD, which also provides curated lay-level information?
WebMD is a Web 1.0 property that is static, practically static, generic. It's not personalized. It doesn't update you on clinical trials, latest research. It doesn't mind the medical literature or anything. Okay, so all people go to WebMD and see prostate cancer and read the same thing. In Medivizor, every single person gets something different based on where they are in their treatment, where are they in the journey, okay, what other, everything about them is different. Just take it, for example, somebody that had a late-stage prostate cancer. They already had a prostatectomy. You don't need to tell them what their prostate is. You don't need to tell them how to treat it in place or how to take it out, okay? So all of that is irrelevant. But if you go to WebMD, these two individuals, one of them late stage, one early stage, will get actually the same information. And that is just crazy in 2018.
All right, thank you. I agree.